Welcome. This session will provide an orientation to the Indian Health Service Injury and Violence Prevention Fellowship Program, also known as the IVP Fellowship. This session will also describe how to identify and outline a project idea and submit a fellowship application. The authors of this presentation are the academic advisors to the IVP Fellowship Program. They have developed the curriculum and will serve as the instructors. They will also provide guidance to the fellows throughout the program. The UNC Healthy Solutions team includes faculty and staff from the Department of Health Behavior at the UNC Gillings School of Global Public Health, which is located in Chapel Hill, North Carolina. The team helps agencies, foundations, organizations, American Indian Alaska Native tribes and tribal organizations, and other groups who want to use evidence-based solutions to achieve equitable health and social outcomes in communities. Here are learning objectives for this session. By the end, you should be able to describe the IHS IVP Fellowship Program and how to apply. Describe 3 fellowship project types. Use a template to develop a project idea. For this session, we recommend you open or have access to the materials listed on this slide. Let's begin with general information about the IVP Fellowship Program. The fellowship provides practical knowledge and skills for injury and violence prevention practitioners working in American Indian and Alaska Native communities. The fellowship builds on learning obtained from IHS IVP courses 1, 2, and 3, and from fellows' prior IVP experience. Fellows develop their IVP skills by planning and implementing a project which will require some form of data collection and analysis. During their project, fellows learn to document all the phases of the project. Each project is concluded with a report and presentation at IHS headquarters. During the fellowship, there will be both synchronous and asynchronous learning activities designed to help fellows enhance their skills in the following areas: searching published literature about an IVP issue, planning and managing an IVP project, promoting community and coalition involvement, identifying and using effective IVP strategies, planning for program evaluation, collecting and analyzing data, and developing and giving a presentation. The following prerequisites must be completed or obtained by the time of application: at least 2 years of experience in public health or at least 1 year of experience working in injury or violence prevention, and completion of the revised curriculum for the IHS IVP courses 1, 2, and 3. This means having taken the courses that were offered starting in 2021. Fellowship participation requires approximately 5 to 8 hours each week. Activities include attending up to 2 distance learning sessions each month and completing the brief assignments that are included in some sessions. Attending 3 in-person sessions, each lasting 3 to 5 days. Completing project tasks. Completing fellowship deliverables. If you are employed, check if your supervisor will allow you to use work time for these activities. If not, you will need to dedicate personal time to participate in the fellowship. The fellowship will occur between January 2025 and June 2026, a total of 18 months, which are divided into 4 project phases: planning, implementation, results, deliverables. During the 18 months, fellows will attend multiple distance learning sessions, attend 3 in-person sessions, 1 at the CDC in Atlanta, Georgia, 1 in an IHS area that will be identified later, and the Fellowship Symposium, which will take place at IHS headquarters in Rockville, Maryland. To attend all 3 sessions, fellows will need to take about 2.5 weeks away from their job. Fellows will need to complete project tasks and submit interim deliverables, for example, drafts of project report sections, and a final project report and slide presentation. Fellows will also need to participate in scheduled progress check meetings with the academic advisors and their mentor. During Phase 1 of the fellowship, from January to June 2025, distance learning will include the following topics: course introduction and overview, searching and reviewing published literature, develop a project and seeking approvals such as IRB, planning project activities and how to implement them. Toward the end of Phase 1, fellows will travel to the Centers for Disease Control and Prevention in Atlanta, Georgia, and participate in the first in-person session planned for May 2025. At this session, fellows meet with CDC subject matter experts to discuss their projects. The CDC staff will ask questions and provide suggestions. Fellows will also work on their projects by planning for data collection and beginning to develop data collection instruments. During Phase 2 of the fellowship, from July to October or November 2025, distance learning will include the following topics: data management, writing a methods section, overview of types of analysis, including quantitative, qualitative. Fellows will also attend in-person session 2, which will be hosted by one of the IHS areas. For this reason, it is called the field course, and it gives fellows the opportunity to receive an overview of local IVP activities and tribal culture, participate in an IVP activity, event, or observation, complete a service project for the hosting area's IP program, promote the IHS IP training program, and network with fellows about their projects. The field course provides a valuable opportunity to engage with a specific tribal culture while obtaining hands-on practice with fellowship tools and skills. During Phase 3, from November 2025 to January 2026, fellows will attend distance learning sessions that introduce them to planning their analysis, including an orientation to some basic statistical tests. During Phase 4, from February to June 2026, distance learning sessions will focus on how to report the results of a project to scientific and tribal audiences. Fellows will attend the third in-person session, which is the Fellowship Symposium hosted at IHS headquarters in Rockville, Maryland. Each fellow will present their project findings to an audience and answer questions. Following the symposium, all fellows will conclude the fellowship experience by completing and submitting their project reports. As part of the fellowship experience, each fellow will be offered an additional continuing education opportunity. This opportunity is optional, and it must be completed by December 31st, 2026. For this opportunity, fellows can choose between a less intensive option, for example, attending a conference, and a more intensive option, for example, taking a university course. The conference could be attended during or after the fellowship, but the university course will only be permitted during the summer sessions or the fall semester after the fellowship has ended. The online application will provide a list of opportunities for both options. Applicants will choose whether they want to take advantage of this offer. If they do, the application will ask them to identify the opportunity they want to take. This will help IHS budget accordingly. The IVP Fellowship Program is supported by many people who provide specific expertise. As mentioned previously, the fellowship will be facilitated by an academic advisor team contracted by the IHS Injury Prevention Program. They will work in consultation with the IHS Injury Prevention Program Manager. Their primary role is to develop and teach the curriculum, guide the fellows' projects, and provide instruction and facilitation for each in-person learning experience. Each fellow will need to identify a mentor for their project. Fellows can work with their area or district IP specialist or some other point of contact to identify a local person who could best serve as mentor. That person can be an IHS injury prevention specialist, for example at the area or district level, or another IHS or tribal employee, for example a supervisor, a colleague, or past fellowship graduate. The mentor's role is to assist the fellow in clarifying their project idea, planning the project including timelines, meeting deadlines, and providing guidance during the project activities. Additional support to the fellows will be provided by groups who will enhance 2 on-site learning experiences. The first trip will be to Atlanta, Georgia, where CDC IVP subject matter experts will meet with fellows to discuss their project ideas. The second trip will be to a selected tribal location where field course hosts will have helped develop an experiential learning opportunity. Key support will also be provided to the entire program through the leadership of the IHS Injury Prevention Program Manager and through the training system supported by the IHS Environmental Health Support Center. The application process for the 2025 to 2026 fellowship involves 2 important dates. By November 8, 2024, prospective applicants will view this webinar, develop a draft project idea, obtain initial feedback from their mentor, and make edits as needed. Upload the project idea to the academic advisors. Schedule and conduct a Zoom consultation session with the academic advisors and their mentor. Then revise their project idea using feedback from the consultation. By December 11, 2024, applicants will submit an online application which becomes available starting October 7. The submitted application must include the applicant's revised project idea. The application is divided into several parts. You can preview a list of all the application parts in Appendix C of the 2025 to 2026 IVP Fellowship Program Summary. The application will request your name and contact information, education and work experience, IVP experience and training, injury or violence problem of interest to you, your ability to participate and travel away from your job or household. Upload your project idea document, letters of support from your mentor, area or district IPP specialist or point of contact, and your supervisor. Documentation showing completion of IHS IVP courses 1, 2, and 3. Online applications can be completed over several days. All questions do not need to be answered in one sitting, but you must use the same computer and the same browser. Complete submissions are due on Wednesday, December 11, 2024 by 1 p.m. Eastern Standard Time. That would be 9 a.m. Alaska Standard Time. At the time of submission, all questions must be answered and all supporting documentation must be provided prior to clicking the Complete My Application step on the final page of the online application. Results will be announced by December 20th, 2024. All applicants will be notified of their status. Now let's explore how to identify a project idea so it can be part of your fellowship application. A fellowship project should align with one or more of the 4 steps in the public health approach. The image on this slide shows the 4 steps of the public health approach which has been emphasized in the IHS IVP courses. We will describe how your project should be aligned with at least one of these steps. In general, projects could focus either on understanding an IVP problem or applying a solution. Steps 1 and 2 of the public health approach focus on discovery and understanding about an injury or violence problem. Steps 3 and 4 of the public health approach focus on a solution because they develop, implement, and evaluate the intervention meant to prevent and reduce the IVP problem. With that emphasis on problem versus program, we can then identify 3 possible types of projects for the fellowship program. The first type of project is about problem analysis. It is aligned with steps 1 and 2 of the public health approach. This type of project would define the problem and identify the risk and protective factors that influence that problem. The project might analyze the rates over time for one injury type, or it might focus on comparing the rates for multiple types of injuries. The project would probably also analyze the risk or protective factors for one or multiple injury types. These activities would contribute to an analysis of the problem. The second type of project is aligned with step 3 of the public health approach, which is to find what prevents the problem. A project might identify an evidence-based intervention and then plan how it will be piloted and evaluated in a local tribal community. All the details of the intervention would be planned out. That is why this second project type is called program planning. The third type of project is aligned with step 4 of the public health approach. It is about evaluating an intervention that was implemented by yourself or someone else. The emphasis here is on understanding what resulted from the intervention. So this project type is called program evaluation. Let's look at some examples of projects. We'll begin with the first type of project, which is focused on problem analysis. The focus is on the problem, not the solution. For example, a project might collect and review secondary data to quantify the problem of elder falls in a tribe. It might estimate the incidence of new cases of elder falls during the past year. It might also review health records to quantify the change in falls cases over the past 5 years. This project would be trying to answer questions about how urgent the elder falls problem is for the tribe and how the amount of elder falls is changing over time. The project would also seek to understand the risk and protective factors for elder falls in the tribe. The project might conduct various types of assessments, such as assessing the balance and strength among the tribe's elderly members. It might also conduct home safety assessments to specifically identify risk factors for falling and to identify protective factors in each home and help ensure those remain in place and are effectively used. Notice for these projects, the emphasis is on understanding the problem of falling and its risk or protective factors. The second project type is focused on program planning. Here, the focus has shifted from the problem to the solution. Specifically, these projects try to plan for an intervention, then pilot test it, and conduct a process evaluation to document what they did and who they reached. For example, a project might identify a training curriculum that is promoted as an evidence-based strategy for the problem. This project would plan how that training curriculum could be used by the tribe. It would develop a plan for managing the training and would pilot test some trainings in specific locations. You can probably sense that the planning process would need to account for expenses and identify locations where the training could be piloted. There is also promotional work to attract participants to the training sessions. This type of project would also need to develop some simple evaluation assessments to help document what happened and people's reaction to the trainings. The process evaluation would then describe the results from those assessments. In this way, the program quantifies what happened and who they reached. The third type of project is about program evaluation. The focus is on what results from a program, so it evaluates both the process and the outcome. There are two possibilities for this third project type. In the first, the fellow evaluates an intervention or program that they are currently implementing or had implemented previously. The fellow would analyze the results from both process and outcome measures. In the second, the fellow evaluates a project that someone else is currently implementing or had implemented previously, again analyzing the results of both process and outcome measures. Let's look at examples of projects which focus on program evaluation. In the first example, the fellow is going to evaluate a Tai Chi course they are currently implementing to help prevent elder falls in a tribe. Here is one possible way this project might happen. The fellow would recruit and train instructors, and then observe a random sample of the classes to document what is happening in the class. The fellow might also survey the students after the classes are completed to measure their satisfaction with the teaching and to measure how much they practiced outside of the class meetings. All of this would be considered the process evaluation part of their project. For the outcome evaluation part of their project, the fellow might work with health providers who use the CDC STEADY tool to assess the class participant strength and balance during their annual physicals before and after the intervention. The fellow might also be trained to do the assessment themselves. Other patients who get assessed for STEADY but who did not take the Tai Chi classes could become a comparison group for the analysis. With these data and a sufficient sample size, they would analyze the program result or outcome. The other type of evaluation project would be to evaluate a program someone else has implemented. For example, if a tribe had already conducted a home assessment program and they had all the hard copy forms with the risk factors for falling in each home, the fellow would use those data to evaluate the outcome of the program. Here is one possible way this project might happen. The fellow might begin by reviewing all the assessment forms. After that, the fellow might interview the tribal staff to understand the details about how they conducted the home assessments. And then the fellow might identify two groups of tribal households that would be compared in terms of the fall's outcome. One would be elders living in the homes that were assessed for risks. The other group would be elders living in homes that were not assessed for risks. We've been describing types of fellowship projects. Now let's take a look at the worksheet that you can use to develop your project idea. To do this, you can pause this presentation and open the document listed on this slide. We suggest setting up your screen to have the worksheet and this YouTube video both visible. Then you will continue playing the presentation. You can pause the presentation now. Let's begin touring the worksheet. We'll look at each section separately. The first part to consider is the need for the project. To complete this part of the template, simply answer the questions in your own words. The template will have your comment appear in a blue font. The second part of the template will help you identify your type of project. Read the description for each project type and select the one that best matches your project. Then yellow highlight the project type you have selected. The third part of the template will help you begin thinking about how you might conduct a project. To complete this part of the worksheet, scroll down to your project type and only answer the questions that appear in that table. We'll point this out for each project type as we continue viewing the template. The next few slides will show you the questions for each project type. For project type 1, the project focuses on analyzing a problem. You'll notice that the top half of this section asks you to yellow highlight either option A or option B, depending on whether the project will explore only one injury or violence problem or if it will compare multiple problems. Then there is a description of what the project might accomplish. Again, only review for option A or option B. In the table at the bottom are questions to answer. They explore your awareness of interventions to prevent or reduce the problem and the stakeholders who are involved. They also inquire about the types of data that you will be able to use and any new data you might need to collect. You might not know how to answer all of the questions, and that's okay. The purpose is to get you thinking about the possibilities and any potential barriers to getting the information you might need. Now let's look at the next project type. For project type 2, the project focuses on planning and pilot testing an evidence-based intervention. Read the description of what the project might accomplish and then answer the questions in the table, which will help you think about whether an evidence-based program already exists that you could use or adapt, or if you will have to develop a program from scratch. The questions also encourage you to think about the population or group with whom you could pilot test the program and how long that pilot test might last. And finally, it asks you to think about what you could document about the pilot test. For example, documenting participant satisfaction or change in knowledge. Now let's look at the third project type. For project type 3, the project focus is on evaluating a program. It could be a program you are implementing currently or in the past, but it could also be a program that someone else has implemented and you will simply be evaluating it. Read the description of what the project might accomplish, and then answer the questions in the table, which will help you think about the people with whom you might share the evaluation results and how you might document the program activities to inform a process evaluation. It also asks you to think about short-term outcome measures. That was a brief orientation to the template that can help you develop a project idea for your fellowship application. It can be helpful to see some examples of how projects are described using the template. To see 3 examples, pause this presentation and turn to the document listed on this slide. When you have completed the review, return to this video. You can pause this presentation now. Welcome back. We hope those example projects helped you see how a project idea can be outlined using the template we provide. The next step in the pre-application process involves you drafting your project idea and getting feedback from a few different people. One important person who should provide feedback on your project idea is your mentor, or the area or district IP program specialist, or the other point of contact. Once you and your mentor agree on a project idea, it's time to meet with the academic advisor team to get their feedback about your project idea. To do this, use the URL link in the description box below this YouTube video or at the web page where you obtained the link to this webinar. The link will let you provide contact information for you and your mentor, upload your project idea by November 3rd, schedule a required consultation before November 8th to discuss your project idea with the Fellowship Academic Advisor team and your mentor. We recommend you select a date that is at least 5 working days after you have uploaded your draft project idea. After meeting with the Academic Advisor team, revise your project idea using their feedback and suggestions. Then when you complete the online fellowship application, you will also upload your revised project idea. Here is a reminder of the timeline for the application process described earlier in this webinar. Beginning October 7, 2024, you can access the online application by returning to the web page where you obtained the link to this webinar. Online applications can be completed over several days. In other words, the questions do not need to be answered in one sitting, but you must use the same computer and the same browser. By November 3rd, upload your project idea for review. By November 8, you should have met with the academic advisors and your mentor to get feedback on your project idea. You will then revise your project idea to submit it with your application. Applications are due by Wednesday, December 11 at 1 p.m. Eastern Standard Time, 9 a.m. Alaska Standard Time. At the time of submission, all questions must be answered and all supporting documents must be provided. Applicants will be notified of the results by December 20, 2024. Thank you for participating in this required webinar. If you have any questions about the pre-application materials or consultation, or about the web-based application process, please contact Robert Letourneau from the Academic Advisor team. This is the end of this presentation.